Have you been on WebMD or maybe Symptom Checker? Well, the care just from some of those very useful tools we can use to check to see if it's really worth a trip to the doctors. But more and more of us are never even making it to the doctor, and we're just self-diagnosing. Dr. Russell Lewis with the University of Maryland School of Medicine is here with us right now talking about the dangers of self-diagnosing. Thank you so much for coming in.
Thank you for having me.
This is something where we have an approach every day in your office, in your exam room. You're dealing with people that are coming in with symptoms. Are you seeing a trend here because there's so much online now that people can say, you know what, oh, I think I have this. Why don't you prescribe me this when they come in? Is it a different approach or an attitude?
Well, I do see that now. Patients come in with a list of questions from a search that they may have done online, and they already have a diagnosis in mind, and it may be something as severe as I think I have a tumor or cancer versus, well, I've been suffering with a migraine, with a headache, and I thought it was a migraine. I've been suffering with it for several years, and now I got to a point where I can no longer manage it, and I come in, and maybe something a little bit more severe that been misdiagnosed or mismanaged at home for several years, and they suffered, and they finally get to a point and say, no, I need to come in to be seen. And so we try to correct that for them.
But it's that approach. I mean, we have the world at our fingertips. We have cell phones right there. We can find the answer out whenever somebody asks a question about a song, whatever it is. We can just say, oh, hold on a second, and look at it and get that instant answer. So are we becoming more independent, thinking that, you know what, we know a little bit more than the doctors do in their own profession?
Well, no, because when you get the information, you're at risk of misdiagnosing yourself. And there's a lot that goes into just placing in a symptom and get an answer as to what you have. We ask for what are your symptoms, what are the duration of your symptoms, what makes it better, what makes it worse. Then we'll look into your past medical history, what type of medications you're taking. And sometimes you have to look into your environment. Where do you work? Have you ever investigated to see if there's any mold in your home? How about the ergonomics at your work site? Maybe that's why you have a headache, you know.
Analyze it a little bit different approach than a simple website. I do know that one of the studies was saying that on the websites, when you do look up symptoms and things, the worst case scenarios normally tend to pop up first, and that's what you're going to click on. I mean, that's what I'm going to click on if I see something. So going back to when you were saying tumors possibly, when it's just really a headache.
Or if you click onto the website and you have a headache, and say, oh, you have migraine, so you get a pop-up ad, say, hey, purchase this particular vitamin or supplement for only $15.99, and you purchase it, and you don't really know what you're getting. And once again, you have diagnosed yourself, you have acted on it, and you may be treating the wrong symptoms, maybe the wrong disease.
And then second opinions, I know, have always been a major practice in medical community. I mean, you know what? If you don't like what my opinion is, you could always go find a second opinion and get it out and weigh it out, that option. But are we now using this more as a second opinion?
Yes, we are. We are. They'll go to a physician, may not like the diagnosis, or maybe that particular treatment did not work for them. So they'll go online, get their second opinion, come up with their own diagnosis, and go out there and once again self-treat, which can be quite dangerous depending on what you're buying over the counters, because you don't know what it is, really.
Great tips right here in putting in a little bit different perspective from somebody that, you know, that's always on my phone, always checking for information, thinking, you know what, I can do this. I'm Mr. Independent. So thank you so much for coming in. We appreciate that, Dr. Lewis.
Okay, thank you for having me.
Yeah, sure. Well, coming up, a Baltimore theater is set for demolition. What will be built in its place that some hope will breathe some new life into that area. And a new mobile app could change the way that you shop for clothes, how you can get your own digital tailor. See that? Even another one right there on your phone. 7:53 is the Fox 45 Morning News Weekends.
Peter T. Nickel is a proud sponsor of Fox 45 News.
Experience the wonders of Maryland when you hike, bike, drive,